What if I told you that your body is kind of like an open book, if you know how to read it, especially when it comes to your heart? Today, we're going to skip the fancy machines and dive into the amazing clues our bodies give up during a simple physical examination.
It's a pretty wild question, right? A good doctor is basically a detective. They're piecing together all these little clues from all over your body that point straight to what's going on inside your chest. Your body leaves this trail of evidence, and today, we're going to follow it.
So, you'd probably guess the first place to check for heart trouble is, well, the chest. But what's really surprising is that some of the most dramatic clues actually show up way higher, in the head and neck. Doctors call these peripheral signs, and they're fascinating.
Okay, so let's get specific. We're going to focus on a condition called aortic valve insufficiency. Basically, it means a really important valve in the heart isn't shutting all the way. This creates a powerful backflow of blood, and that sends these crazy pressure waves through the whole body. They're so distinct that a doctor can spot 4 classic signs just by looking. Let's break them down.
First up, we have Musset's sign. This one is pretty wild. It's this involuntary, rhythmic nodding of the head, and it's perfectly in time with the heartbeat. Just imagine your pulse being so strong it literally moves your head with every single beat. It's super subtle, but once you know what you're looking for, you can't miss it.
And it gets even crazier. Next is the Landolfi symptom. This is when the pupils of your eyes actually get smaller and bigger, contract and dilate, in sync with your pulse. Think about that for a second. That massive pressure wave from the heart is affecting the teeny tiny blood vessels in your eye. Incredible.
The clues can be even more tucked away. Take Muller's symptom. This one involves rhythmic color changes in the back of the throat, on the tonsils. Again, it's that same powerful pulse, just making itself visible in a place you would never think to look.
And finally, the 4th sign is probably the easiest one to spot, a super strong, visible pulse in the carotid arteries in the neck. Sometimes they even call it a dancing carotid. So when a doctor sees all 4 of these signs together, well, it paints a really clear picture of what's going on with that aortic valve.
Okay, so after checking for all those signs up in the head and neck, the examination moves down to the heart's home turf, the chest area. Now, instead of looking for those distant echoes of the heartbeat, we're looking right at the source.
Now here, a doctor has to tell the difference between 2 kinds of pulsation. First, there's the apex beat. That's a small, very localized pulse you can feel right at the tip of the heart, and it can be totally normal. But then there's the cardiac beat. This is way different. It's a much wider, kind of shuddering motion of the whole chest area, and that is always a sign that something's up, usually pointing to an enlarged right ventricle.
But here's a funny little twist. In about 30% of people who are perfectly healthy, you can't find that normal apex beat at all. It's just not there. And its absence isn't necessarily a red flag, which is exactly why a physical exam is all about collecting a bunch of evidence, not just relying on one single clue.
So, seeing these beats is one piece of the puzzle. The next step is actually feeling them. This is the art of palpation, and it's where a doctor uses their hands to get some incredibly detailed info about the heart's position, its rhythm, and even its strength. The technique itself is actually pretty methodical. The doctor will place their hand across the patient's chest, with the base of their palm right on the sternum. This lets their fingers spread out over the exact spot where that apex beat is usually found, allowing them to pinpoint its precise location.
But just finding the beat? That's only the beginning. The real detective work is in decoding what it all means. Where it's located, how big it is, even how it feels under the fingertips. All of that provides critical clues about the heart's condition.
First off, a doctor's got to consider the context, right? The location of the apex beat isn't set in stone. It can move around depending on your body position, or if your diaphragm is higher, like during pregnancy, or even because of pressure changes from lung conditions. So a doctor has to factor in all these variables to know if a beat's location is normal or if it's a sign of trouble.
And this is where the clues get super specific. A normal apex beat is small, like less than 2 centimeters. If it feels wider than that, what they call diffuse, that suggests the left ventricle is enlarged. What about the force? If the beat feels way too strong, it could mean the heart muscle's overworking. Too weak? That suggests it might be failing. Even the resistance, how firm it feels, tells a story. A really firm beat points to a thickening muscle. But a soft one, that can mean the heart muscle is starting to give out.
So you can see how all these little clues start to come together to form a diagnosis. It's not just one thing. It's the very specific combination of a beat that's wide and low and weak and soft that points directly to a failing left ventricle. Each one of those sensations from the palpation just adds another layer to the story.
So, what's the big takeaway here? What does all this tell us?
Well, it really speaks to the incredible diagnostic power that's hidden in the most basic clinical skills, in the simple acts of just looking and touching.
Think about it. Without a single piece of high-tech equipment, a doctor can gather a massive amount of information. That rhythmic nodding of a head, or the specific way a pulse feels under their fingertips. These aren't just weird medical facts. They are crucial data points in the very detailed story the body tells about the heart.
And that kind of leaves us with one final thought to chew on. In our modern world, which is so full of MRIs and CT scans, is there a risk that these fundamental skills are becoming a lost art? Because as we've just seen, the simple, elegant act of a physical exam is still a profoundly powerful tool for reading the secrets of the human heart.